to Shri Ram Medical College. Today we will explore terminology used in the operating room by physicians and other medical professionals. Lesson 03. Preoperative assessment. Clinic. A nurse or doctor determines if you are fit for surgery. They'll also order any tests you need and provide information about your hospital stay. Premed, or premedication, medications that are taken before a medical procedure or other therapy is administered. Pulmonary embolus, PA. A pulmonary embolism is the result of a fragment of a deep vein thrombosis, DVT, in the leg or belly that has traveled to the pulmonary veins. Pulmonary function tests, lung function tests. The capacity of lungs to take in and expel air is evaluated with a battery of breathing tests. The efficiency of carry oxygen to your blood is evaluated. Pulse oximeter, a peg-like probe that can be inserted into a finger, toe, or earlobe to determine the percentage of oxygen in the blood. Recovery room, also called post-anaesthesia care unit, PACU, a room or space next to the operation room where patients can come out of anesthesia in peace. Care is provided there until you are well enough to go back to the ward or go home. Regional anesthesia, injecting local anesthetic close to a cluster of nerves or a big nerve might render the area numb. Resuscitation, the process of caring for a patient who is critically ill and requires immediate life-saving care. Risk, the potential for something to inflict harm. There is a direct correlation between risk and probability. Scrub suit, doctors and other medical personnel in operating rooms typically wear baggy tops and pants. Sedation, medication prescribed to make the patient feel at ease and tranquil. Sensory messages, it is the job of certain nerves to relay information from the skin or other organs to the spinal cord or brain. We may refer to these as sensory messages. Spinal, having to do with the back or the spine. Spinal anesthetic, an injection of local anesthetic into the back. A local anesthetic solution is injected into your lower body using a very little needle. The effectiveness is instantaneous but only lasts for around 2 hours. It is also utilized in several orthopedic, neurological and gynecological procedures and most typically during cesarean sections. Sputum, phlegm, spit that contains some of the mucus you've coughed up from your lungs. Starvation time, fasting time, the time frame in which eating and drinking are prohibited prior to undergoing medical procedures. Clear liquids can be had 2 hours after food and food can be consumed after 2 hours. Suction, a device designed to collect fluids, such as saliva or urine. Suppository, the medicine is contained in a small, solid pill that is inserted into the anus, back channel, and dissolved there. This is a practical method of administering medications for the treatment of pain and illness. Surgical stockings, support stockings made of elastic fabric, worn to lessen the likelihood of developing a pulmonary embolism or deep vein thrombosis, DVT, in the legs. Sutures, stitches. Tachycardia, a heartbeat that is very fast. Transverse abdominis plane, TAP, block. A nerve block is a procedure that helps relieve pain after surgery by numbing a specific area of the abdomen. Typically, ultrasonography is used to guide the insertion process. Temperature probe, instruments for gauging the temperature of the interior of your body. theatre, a huge room in a hospital that is dedicated to the performance of surgical procedures. Thromboprophylaxis, any treatment that is intended to prevent the clotting of blood in the veins in your body. It's possible that this will involve the use of medications, anticoagulants, and/or techniques to compress your veins, like surgical stockings. Topical, in the first place. In most cases, this refers to the process of applying a drop of a local anesthetic to a region, such as your eye, in order to numb it. Tourniquet, a band that can be wrapped around a vein to prevent blood from flowing through it. This is typically done either during surgery or when obtaining a blood sample. Trachea, windpipe, the tube that runs from the roof of your mouth to the bottom of your lungs and back up again. Ultrasound, ultrasonic waves with a high frequency used to visualize the inside organs and tissues of the body. The most common method for viewing images of one's unborn child's development in the womb. Urea and electrolytes, U&Es, a blood test that evaluates the function of your kidneys as well as the levels of minerals in your blood. Urine, fluid that is expelled by your kidneys and contains waste materials that have been produced by your body. Urometer, a container made of plastic that collects urine and is connected to a urinary catheter, also known as a tube that removes urine from the bladder. It includes markings on it that allow you to measure properly how much pee you produce in each hour. Valve, a part of your body that regulates blood pressure and circulation. The heart's valves ensure that blood flows in the right direction when it is pumped from the heart's chambers and throughout the body. To aid blood in making its way back to the heart, you also have a system of tiny valves in your veins. Vein, a blood vessel that takes blood back to your heart. They are darker in color than arteries as the blood cells are carrying less oxygen. Ventilator, a device that, in the absence of manual respiration, infuses the lungs with oxygen and anesthetic gases and expels carbon dioxide. Vomiting, sickness is the result. What we commonly refer to as throwing up is actually a forceful evacuation of the stomach. Wane, this is the moment an ICU patient takes control of their own breathing again. The ventilator's assistance is reduced as your breathing improves, and eventually it is eliminated altogether. White cells, white blood cells that aid in the battle against disease. The immune system relies on them. World Health Organization (WHO) checklist or surgical checklist, checks that everyone in the theater crew must perform. This double check ensures that all details of your operation are in order and communicated both before it begins and as it concludes. This is standard procedure for any operation in the United Kingdom. Join ShriRam Medical College's Bachelor of Vocation in Radiology and Medical Imaging Technology and take the first step toward a successful career in radiology technologist. We are here to assist you in launching your career as a radiology technologist. Call us at 9968193009 for more information about our program or to submit an application right away. ShriRam Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website ShriRamCollege.com and like, share, subscribe our YouTube channel ShriRam Medical College. Good luck, goodbye.